You are listening to the Mara Mukwanda Show on Salam Media. It is 12:37 on this Tuesday, the 19th of January, 2021, and it's time for our Women's Health Tuesdays with our resident OBGYN, Dr. Tom Mokaya. Today we are talking about interstitial cystitis. If you have no idea what that is, stay tuned and sit back and relax. And if you do have an idea and are looking for some assistance, you can leave your questions in the comment section below, or you can send them to us on WhatsApp. The number is 061 766 0355. Dr. Tom, hi.
Hi, how are you to you and your listeners?
Good, thanks. And yourself, doctor?
I'm good.
Awesome.
I hope you're good.
So, despite the new variant and the new level 3 of the lockdown, the show must go on. So yeah, I'm very well, thank you. So doctor, what is interstitial cystitis, and why is it so often mistaken for UTIs?
Interstitial cystitis, first of all, is a difficult term to pronounce. Interstitial cystitis, if I may define it, let me use the word cystitis first, because that is easier. Cystitis essentially means an inflammation of the bladder. Mm-hmm. So the technical terminology of cystitis, when it's referred to the bladder, is called inflammation of the bladder. Now, interstitial is the lining of the bladder has 3 layers, and one of the layers is called the interstitial, and that is the one that gets inflamed. So essentially, to define it crudely, is that it's a form of inflammation of the lining of the bladder.
Mm-hmm. Right.
Now,
what? Oh, sorry.
Okay,
you may continue, Doctor.
Now, because it's an inflammation, as you say, it's very easy to confuse it with inflammation caused by a bacteria. Now, this particular form of inflammation can be caused either by something where there is injury, or where there is injury, or where there is a bacteria. So that can cause an inflammation. But this particular one, we don't really know the cause of the inflammation.
Mm-hmm. Mm-hmm. Then what triggers
can you hear me?
cystitis? Yes, I can hear you. Doctor, did you get my question? What triggers interstitial cystitis? All right, I think we are experiencing some technical difficulties. Doctor, if you can hear me, please, you may continue. What triggers interstitial cystitis?
Now, what triggers interstitial cystitis is most of the time, the normal causes of what triggers is not really known. Mm-hmm. But we know that it is associated with the hormones. If the hormones of, let's say, estrogen, when the estrogen level go up or down, that can be able to trigger it. It's also associated with diet and what we drink. Particular foods, if they're spicy foods, they can trigger interstitial cystitis, or caffeinated drinks like coffee or Coke, or even acidic drinks. If one gets to drink either acidic drinks which have a lot of acid, like vitamin C or fruits which have a lot of acid, that can trigger the interstitial cystitis, because what that does is that it goes into the lining, and then it stimulates that inflammation, and that is triggered. The main symptoms are like the patient will complain of lower abdominal pain. Now, pain around the blood area, And the symptoms are almost identical to the symptoms of a bladder infection, where there's pain there. One may have, one may find that when they pass urine, it burns, and when the bladder is empty, they get relieved. And most of the time, 90% of the time, it is treated as a bladder infection. So anytime somebody has had a bladder infection and it has been treated and then it doesn't get better, because interstitial cystitis does not respond to antibiotics. And if one has had a bladder infection and it has been treated with antibiotics and it's not getting better, it is important that one either tells a healthcare professional, or the healthcare professional starts to think that it is possibly interstitial cystitis. Now, the diagnosis of interstitial cystitis can be difficult because when one has a UTI, a urinary bladder infection, the urine is checked. And once we check the urine, we either see a bacteria or we see some cells that suggest that one has the bacteria. But in interstitial cystitis, one does not see any bacteria. The urine is very clear. The urine is sent to the laboratory. We don't culture any bacteria. So in cases like that, one needs to start thinking that it could be interstitial cystitis, which therefore means that interstitial cystitis is a diagnosis of exclusion. Once you've excluded everything, then you need to start suspecting that it is interstitial cystitis.
Is there a cure for it, or how is it treated?
Now, first of all, we have to make the diagnosis.
Yes.
And most of the time, the diagnosis is made. The confirmatory diagnosis is made when one is taken to theater and with the assistance of a urologist. These are doctors who specialize in the bladder and the kidney, etc., etc. They put a camera into the bladder. And once they put a camera into the bladder, they can see how the bladder looks. And in interstitial cystitis, there is a characteristic look that they see when they put a camera into the bladder. Now, at the same time, they also take biopsies. They take up pieces of the wall of the bladder and is taken for analysis. And once it's analyzed, then that diagnosis of interstitial cystitis is made. So the exact diagnosis, apart of course, obviously from diagnosis of exclusion, the urologist will be able to tell us that, yes, I took a biopsy and it confirmed that I've got, one has got interstitial cystitis. Now, the treatment, first of all, starts by behavioral change. One needs to avoid things that stimulate the pain, and this includes particular drinks, as we said, caffeinated drinks, acidic drinks, drinks which have a lot of vitamin C, a lot of fruits. So one needs to avoid that. And we know that stress can also precipitate the pain of interstitial cystitis. So one needs to manage stress. And in instances where one is not able to manage the stress, then we actually prescribe some mild anxiolytic, some of them called amitriptyline, which are used to treat anxiety. And we find that as a first-line treatment really tends to help. And in instances where all this conservative medical treatment fails, then we send those patients to a urologist, who again puts a camera into the bladder. And then there is a particular specialized chemical that they spray around the lining of the womb. So the lining of the bladder, rather, the lining of the bladder, so that that inflammation is controlled. But most of the time, because getting a urologist is not always easy, the initial treatment is by behavioral change and changing the diet, avoiding spicy foods and acidic drinks.
Mm-hmm. Speaking about diet, does drinking a lot of water help calm the flare up, or it just helps now and then, or it doesn't help at all?
Now, that will only be able to help with the symptoms that are there, and some of what you said at times in some patients it tends to work, and in some patients it doesn't work. So one has to individualize, observe themselves, find out which behavioral change works and which one does not work, because interstitial cystitis is a disease which we understand up to a particular level. And we are one of the first people to say that we have identified the disease. We understand, you may find that some aspect of the treatment or treatment may work for somebody, and they don't work for somebody else. So at times it's actually trial and error.
Mm-hmm. All right, so and doctor, quickly tell us, can anything happen if IC goes untreated, interstitial cystitis?
Now, most of the time, if it remains untreated, it may cause a lot of distress. Nobody wants to have pain.
Yes.
Fortunately, there are some patients who they have a flare up where they have interstitial cystitis where it causes pain. It lasts for a couple of days or a few weeks, and then it goes away, and then it doesn't come back for a month or 2 months or 3 months. So it has waves where it goes up and down. In instances where it is persistent, then one needs to have treatment, because pain can cause depression. So if it remains for a long time, fortunately, it won't cause cancer, but it will cause what we call as CPP, chronic pelvic syndrome, where there is a lot of pain in the pelvis all the time. And one knows what is associated with pain. You know, some people get depressed, they become moody, they become unfriendly. So it may be associated with a lot of psychological disturbances. But if left for a long time, the bladder wall tends to gets to get inflamed, and some women find that they can't retain urine for a long time. So after some time, every time the urine gets full a little bit, they pass urine. So it may actually lead to what we call as urinary incontinence, where one just passes urine without their control.
Mm-hmm. Wow, we live to learn. And for those of you who would still like some more information on interstitial cystitis, you may leave your comments in the comment section below, or you can send them to us on WhatsApp. The number is 0617660355. You are listening to the Mariam Okwanda Show on Salam Media. Dr. Tom Mokaya, thank you so much for your time once again and for the knowledge and tips that you've just shared with us.
All right, thank you.
Thank you. That was Dr. Tom Mokaya, an OBGYN, taking us through interstitial cystitis versus UTI, or urinary tract infection. And as the doctor mentioned, it is something that it's a bit difficult to diagnose because it does resemble bladder infection. So you might be having symptoms and you think that it is a bladder infection, but it turns out to be interstitial cystitis. So do get checked out, and also go for a second opinion if the first one comes out as a bladder infection and the treatment for bladder infection does not work. So just stay with us. We will be right back.